Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you notice, I just took off my mask, and I have taken my vaccine properly, and otherwise I'm just appearing to you and suggesting to you that this mask is not Democrat, Republican, whatever, liberal, conservative. It's an opportunity to save your life and save misery for your family, so wear your mask. Anyway, this program is called Dateline Health. As I said, it comes to you from Nova Southeastern University. We've had a lot of questions. As you know, this show has always been, for the last 22 years, a show that's driven by questions that come from you, the audience. So we've had a lot of questions about pregnancy, birth, child milestones, screenings, women's health, and a lot of it, we'll get into a bit of it, but I want to stay on target. So let me first introduce to you Dr. Emily Sue, DO. She's a pediatrician, and she works at the Heart and Family Health Institute / Cardiology in Port St Lucie, which I believe is an element of the HCA system, correct?
It is.
Well, Dr. Sue, welcome, and we're glad to have you. It's the topic of the show, obviously, is raising healthy children. So why don't you start out?
Well, hi, everybody. Thanks for the invitation. I just want to say, in this time of this pandemic, and I know there are a lot of questions about vaccines, I'm here to answer any questions you guys might have about vaccines, whether they're regular childhood prevention vaccines or the COVID vaccine. Right now, it's only FDA approved for 12 and above, but there are studies currently underway for under 12 years old. Any questions you have, I'm here.
Well, we're not going to ask you many questions. We may lead you into commentary, but you can say whatever you want to say, so go right ahead.
I think it's important during this time to not forget our primary care prevention. Last year, for the past 18 months, there's been a lot of primary care visits and prevention and wellness checkpoints that were missed. So there are a lot of babies born during the pandemic who did not receive any of their first year vaccines or well visits, which are important for their developmental milestone checks. As we go into a new phase of potentially a increase in COVID uptakes with new variants, we have found ways that you can safely visit your doctor's office, and we encourage that. I would advise parents with children under 2 to see if they can schedule for their child's visit to be the first one of the day. So if it's an 8 o'clock visit, be there at 8 o'clock. So there's less exposure in the air. This way you can make sure all your children are meeting all their developmental milestones. They can get their proper vaccines, and just any questions you might have. Life still goes on. So we want to make sure everyone's getting the prevention and the wellness checkpoints.
Medicine is always try to prevent so that you can cure, and if you can't prevent, you cure. But it's particularly interesting in what you said, because there are a lot of folks that are out there that are worried now, because now we have opening of schools, and there is some inconsistent, or in some cases, and consistent in other cases, of what is going to happen with the children that are under the age of 12. I mean, I know now the most recent, as we are talking now, and it might change by the time it gets on air, is that vaccines available from age 12 up. But what's your thoughts about it?
I think every family needs to do what's comfortable for them, but it's important to remember that most schools are not going to stop you if you want your child to wear a mask at school. The normal hygiene standard precautions should be taken, for example, washing our hands before eating. I always advise when children come home from school to wash their hands first thing when they get home, especially if you have younger siblings at home. So you don't transmit any type of viruses actually back home. And I think not everybody can do another year of homeschooling. The resources can be very tight, and a lot of jobs and positions are opening up where parents don't have the option for daycare. So the same precautions go for any child basically going to school. You monitor your children for signs of illness, so cough, it can be runny nose, any GI symptoms such as abdominal pain, vomiting, diarrhea. Some children complain of headaches and fever. And if you have any questions, concerns, I think it's important to go and bring your child to your pediatrician or family physician for a checkup and testing. And I would definitely advise, if your child or anyone in your family does have a positive COVID test, it's prudent that you keep your child home from school to prevent transmission, and you as well. They say 7 to 10 days, depending on if you have symptoms, etc.
Okay, well, let's now hear from Dr. Brooke Slaton, who is MD OB-GYN, and she's affiliated with Omega Women's Care at Northwest Medical Center here in Broward County. So Dr. Slaton, you're at the other side of this thing, but yet there's a lot of questions that come to us about pregnancy, and there's a lot of, shall we say, unusual, if not believable by some, as to the effect of the viral spread and the problems relative to vaccines. How about your thoughts on that, Dr. Slaton?
Hi, thanks for having me today. I think it's been a really trying time. The pandemic has brought all kinds of new things for doctors and for patients. Prenatal care has always been very important. And I think we saw a lot of fear from patients not wanting to come in for appointments, missed opportunities for the types of screening and preventative care that we can offer, just like Dr. Sue was saying with the children. So, we have made changes throughout, seeing patients less frequently or more frequently, or doing telephone visits and Zoom type visits in order to maintain contact with our patients and make sure they're getting the best care. I think in regards to the vaccine, pregnant patients are very nervous about getting a vaccine, and I can understand that. However, pregnant patients are also extremely high risk to get COVID. And when they get COVID, they can be much harder to treat than a non-pregnant patient. Their immune systems are different. That's part of what allows us to be pregnant with a baby, is changes in our immune system during pregnancy. I 100% recommend to all of my patients to be vaccinated. It is recommended by the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine, which is basically a high-risk pregnancy society. Unfortunately, in this unprecedented time, we don't really have data to know that it's safe in pregnancy, but these vaccines are made in the same way that the other, what we call dead vaccines, are made. Live vaccines are not recommended in pregnancy, but vaccines like COVID, the flu vaccine, have always been recommended in pregnancy, and can really change the risk for our patients.
Of course, this gets to the whole issue of raising healthy children or preparing for pregnancy and birth. I know that, as Dr. Seuss indicated, a lot of folks, because of the availability of venues to go to, whether they be direct doctor's offices or clinics, I'm talking about hospital groupings, they weren't available because they were so busy trying to save people's lives during the height of the pandemic. Things have changed within the last few months?
I think that's a really great question, Dr. Lippman. I am seeing patients who are considering pregnancy start asking questions about, should I get vaccinated before I get pregnant? Patients have concerns that if they get vaccinated, that they might not be able to get pregnant. There's no data to support this. I definitely recommend that patients get vaccinated before getting pregnant, if at all possible. I also recommend to patients who maybe don't feel comfortable getting vaccinated during the pregnancy, I recommend that they get vaccinated immediately afterwards. Because if they're breastfeeding, they can potentially give antibodies to the baby, which at this point is the only way for us to help protect the younger children.
And in general, I mean, taking the pandemic question out of the way, just give us sort of a rundown. If my wife, my daughter, whatever, my grandchild or whatever is involved in a pregnancy situation, how often would you normally see that particular person during the period of time of the so-called 9-month period?
That's a great question. We usually see patients about 4 to 6 weeks after their last period. And then typically we see them once a month until they get to be about 28 weeks pregnant. And then every 2 weeks until about 36 weeks pregnant. And then for the last month of their pregnancy, we tend to see them once a week. And this schedule is based on, prenatal care was developed in the 1800s as a way to try to prevent women from having seizures in pregnancy. It was recognized that the later patients got in the pregnancy, they could develop something called preeclampsia and have seizures. And we noticed that if we did some kind of prenatal care, we could be looking for evidence of that before it got to the point of having seizures, and we could reduce maternal deaths. So this is kind of why we have this schedule. The visits are less frequent early in the pregnancy, and they become more and more frequent as we get further along in the pregnancy, because the chances of picking up a problem are higher towards the end of the pregnancy. Of course, things are a lot different than they were in the 1800s. We're able to offer all other types of preventative care and psychosocial help to our patients. And so as we move along through this schedule, we also offer different types of testing and vaccinations, et cetera, during that time frame.
I just wonder, in your grouping or your Omega Women's Care Center, whether you have specific individuals who deal with patients that have had difficult pregnancies. Really, I know it's a style of care that's a little bit different. So I just wondered if you would touch on that for a minute. We had a lot of questions from our viewers about that issue.
Yeah, there are a variety of things that can make a pregnancy high risk. Some of those things can be cared for in a private practice like mine. Some of them really require a higher level of care. So patients with certain complications are best served at a higher risk facility. So it really is on a case by case basis. Definitely we see patients that have high risk problems. It's just kind of looking at what is going to be the safest thing for the patient, what kinds of things do they need to have available to them, consultants, et cetera, and then making choices about where they can get the best care. Because ultimately that's our goal, is to make sure that each of our patients gets the best care that they can get.
Well, to both of you, really, you have a privilege now of having the enlightenment of, I guess, general health care, where there are units that are built into hospitals that are specific to premature birth. Everything from, the premature birthing itself to step-down units, to et cetera. I wonder if, Dr. Sue, you are a pediatrician, and I guess you get involved after the birthing, along with, obviously, the OB-GYN and the specialty units in the various hospitals. But what's your involvement? What's your involvement?
The current hospital that I work at, we don't have a NICU, so we're present, the pediatricians are present for any of the normal births. We intercept the baby after the baby is delivered, and we do the regular exam, the checkup. We follow them for 2 days, check their billy, check their blood. and send them home with a outpatient follow-up for 2 to 5 days. Now, where I trained, we have a level 1 NICU, and at that point, we have babies that we've saved from 21 weekers, 22 to 23. So usually when we are aware that a mom is going to need a higher level of care, we send them before the delivery date, if we can, to a higher tertiary level care.
Unfortunately, our infant mortality rate is still pretty high. What's your thoughts?
It depends on what age group you're really talking about, but we keep lowering the age for, it's a dual decision-making process. So it's the neonatologist along with the parental consent of when and how much they want to resuscitate their baby under 24 weeks. So I think the mortality rate is a little bit affected by the new advances that have come out. So there's more hope for babies born under 24 weeks. So I think with the hope, there are more parents willing to see if they can resuscitate and to see how far they can bring their baby along. In terms of the babies that aren't so premature and their infant mortality rate, I think a lot of it really has to do with the socioeconomic status of a lot of mommies, where they're not, the nutrition level and the follow-up care may not be as present as it should be. It's something I think as a society that we're working on to get prenatal care to everybody all across the board for socioeconomic statuses.
Dr. Slaton, I know that at Northwest Medical Center, you have a unit that's pretty, shall we say, up to date on everything. And so what's your thoughts on this?
Well, I think this goes right back to why prenatal care is so important, because there are ways that we can try to prevent the preterm delivery. We have a patient who's had a preterm delivery before. We have, treatments that work really well to reduce their risk in the future. So a lot of this is about having good prenatal care and managing things to hopefully reduce that low birth weight or extreme preterm delivery. We do have a very high level NICU. I'm lucky to have that at our hospital. We do have a level 3 NICU, so we are able to take care of the very small babies. But there are some treatments that are only available at certain hospitals. And sometimes we do have to transfer patients to other, meaning premature babies. Sometimes we do need to transfer them elsewhere where they can get some of the, most advanced technologies that aren't even available at our high level, level 3 NICU.
So your NICU unit, it's pretty sophisticated, but do you have a step-down unit there too?
Oh yeah, we have pretty much everything. I think when it just gets to some of the really advanced technology that they have to be moved sometimes, but it's rare. And we try to, in our prenatal care, we try to figure out who might need that, because our goal is to keep mommy and baby together as much as possible. So if we know we have a patient who's maybe going to need a higher level of care, we try to get them to deliver at a place where they can have everything they need. But most babies and most deliveries we can take care of at my facility, and it's really nice to be able to maintain that patient contact throughout the pregnancy and delivery.
Okay, so now we're down to the point where, again, this is questions that come from our viewers all the time. What can I do to get a healthy baby? What's your general look now at your wonderful professions that you both serve in, to bring to our viewers an understanding of how they can have and prepare for healthy children and a healthy birthing? So I'm giving it to you. Go to it, Dr. Slaton.
That's a great question. I think that patients need to be as healthy as they can be before they get pregnant. So people who have problems like high blood pressure or diabetes or other pre-existing conditions really need to optimize their own health prior to pregnancy. They need to have good prenatal care from an early stage in order to have the best preventative measures and ways that we can help them to have as healthy of a pregnancy as they can. And then back to the vaccine issue. Get your COVID vaccine before you get pregnant.
Dr. Sue, what do you have to add to that?
I think what Dr. Slaton said basically covers everything. I just would recommend that if, for a parent's sake of mind, I would recommend that if you're thinking of home births or doulas, make sure that there's a contingency plan of some hospital nearby where you have an OB-GYN, a medical doctor on stand for when if something goes wrong, you want someone there prepared. I just want to stress that your nearest hospital, for example, St Lucie does not have a NICU, but 30 minutes away at Lawnwood, there is a level 3 NICU. I would be aware of where your next higher level care centers are in the event that you may need them. Otherwise, good nutrition, good rest, and the vaccines.
And explain what a NICU is. Go ahead.
A NICU is a neonatal intensive care unit. There are 3 levels. Levels 1 and 2 are basically for your pretty healthy, almost near-term or term infants that have not very complicated postpartum issues. Level 3s are for your extreme preemies or any babies that have any more severe or complicated issues. If you keep in regular contact with the OB-GYN throughout your pregnancy, usually there's a contingency plan in place and there's no problems. I would mostly just recommend that you have a plan for if you are going to do this. I know it's a new and sort of a rising trend to do a home birth with midwives or doulas. I just recommend you have a OB-GYN who knows about your case and your situation in case anything goes wrong. You just want to be prepared in case anything goes wrong.
Well, Dr. Slaton, what do you have to add to that?
Dr. Stu, I'm happy that you brought up the idea of home birth. I mean, as an OB-GYN, it's not my choice of how to deliver. I know that it has become sort of an interest of patients as of late. I think there's a reason why we've been doing deliveries in hospitals. And yes, women have been delivering for a long time, and a lot of times it goes without any problems. But when there is a problem, it's usually a momentary decision that makes an extreme difference in both mom and baby's lives. So I'm a fan of hospital birth, and I agree, if you choose to deliver at home, you definitely need to have a backup plan of if that possible thing goes wrong.
You know, we're very blessed. I look at both of you and I tell you, we're very blessed here in particularly in South Florida, Dade, Broward, Palm Beach County, all the way up to Port St. Lucie, well beyond those 3 counties, but really up to the I-4 corridor, really. We have, you know, the whole medical compendium, the whole ability to have the best of best care. It really does relate to new methodology, equipment, capability of the facilities, because we have to do something. The reason why I wanted both of you on today is because the driving force of the questions that came to us from viewers is, why do we have so many childbirthing deaths? I mean, why do we have, what percentage, what in a beautiful state like Florida, how does that happen? But I think you've given us a good look at it. So maybe we're down to the last 30 seconds of the show. So Dr. Slaton, what do you think?
I think everybody should try to take good care of themselves and keep their families safe by having prenatal care and asking the questions that they're not sure of to their physicians and having a conversation, not being afraid to ask about what their concerns are and make good informed choices.
I just think everyone should go for their annual physicals, your well child checks, just for the routine stuff. I know we're in the middle of a pandemic, but life is still happening and your children are still growing. So you want the vaccines, you want to make sure you're keeping them mentally and physically safe, and ask any question you have to your provider at any point. And
the one thing that I didn't bring up to either one of you is that we still have we have almost a pandemic of obesity in the United States, not in necessarily just the state of Florida. And that plays another part of having a healthy birthing. But I'm not going to get into that now. I want to thank both of you, Dr. Emily Sue, DO, pediatrician at the Heart and Family Health Institute in Port St. Lucie, and Dr. Brooke Slaton, Omega Women's Care at Northwest Medical Center right here in Broward County. So thank you both for being here today. We listen to our viewers, and it's come up over and over again, and now that you brought in the vaccine issue, I think that makes another issue that they have to think about. So I want to thank both of you for being here today. You're appearing on a program called Dateline Health from Nova Southeastern University, and I always say, and I believe it was you, I don't know which one, maybe you both said it, but you have to talk to your doctors. If you have any questions, you have any comments, there's an email address and a telephone number right here. My name is Fred Lippman. We come to you from Nova Southeastern University. This program is called Dateline Health. Until next time, see you.